Good afternoon. My name is Robert Bullard, and I direct the Environmental Justice Resource Center at Clark Atlanta University in Atlanta, Georgia. For the last 30 years, I've worked on issues at the intersection of race, environment, and health. And I think it's important to understand for some people in the room that this is not, this is historic, to have all these cabinet members come together and to reinvigorate and restart the interagency working group. But some of us who are in here with gray hair remember this is a little deja vu all over again. We were here in '94 talking about some of the same issues, confronting some of the same concerns, and I think it's important that we take it to the next level. In looking at listening to the last panel that was talking about green jobs, I think it's important to understand that there's some of us who have operated and directed a green jobs program for at least 16 years. I'm giving kudos to the National Institute of Environmental Health, their Minority Worker Training Program, and the interaction and the relationship that it has had with impacted communities and historically black college and university training programs and other institutions. So let's be mindful of history as we make history. It's my pleasure and distinct honor to introduce the next cabinet member speaker, Secretary Kathleen Sebelius. She was sworn in as the 21st Secretary of the Department of Health and Human Services in April of 2009, and she oversees one of the largest civilian departments in the federal government, nearly 80,000 employees. Since taking office, Secretary Sebelius has been a leader in some of President Obama's top priorities. As the country's leading and highest-ranking health official, she is guiding the implementation of the Historic Affordable Care Act. In 2010, she was named by Modern Healthcare as America's second most powerful person in healthcare. Under Secretary Sebelius' leadership, HHS has played a key role in the administration's aggressive response to the economic downturn, helping families stay on their feet by providing health care, job training, child care, and energy assistance. For over 20 years, Secretary Sebelius, working in the area, has made her mark. And in 2005, Time magazine recognized her achievements by naming her one of America's top 5 governors. Ladies and gentlemen, the Honorable Kathleen Sebelius.
Thank you. Thank you all for that warm welcome. If you think that counts as your afternoon exercise, get over it. It doesn't. But I am delighted to have a chance to join you here today, and I want to thank Dr. Bullard for that nice introduction, but more than that, for his incredible leadership on a number of these important issues. He's been at this work for decades, and I think the fact that he is here helping to lead this important gathering is a tribute to the fact that the mission is not yet completed. I think it's also noticeable that you've had about half the cabinet here in and out, and it's not just because Nancy Sutley and Lisa are very convincing, tenacious, I would say, but it also, I think, is a tribute to the years of hard work that leaders like Dr. Bullard and many of you advocates in the room today have been about how environmental justice affects all of us and is a key priority. Now, environmental justice hasn't necessarily been part of the traditional lexicon at HHS, particularly in recent years, but I'm glad we're here today, and I'm glad with Lisa's leadership and the commitment from all of us, we are very pleased to join this effort. We have the frame at HHS that there is nothing more important than health, that health is freedom. And when we live longer, healthier lives, we have more time to do our jobs, we have more time to volunteer in our neighborhoods, to play with our children, to watch our grandchildren grow up. And health is also one of the key foundations for our country's prosperity. We know that healthy adults are more productive workers, that healthy children are better students, and that healthy families can make more significant contributions to their communities. But today, I think we understand much more than ever that health is not just about determining what happens in a doctor's office or in an operating room. It doesn't happen only around the medical profession. Health is largely determined by where you live, where you work, where you go to school, where you play, what you eat and drink, the air you breathe, and how you get around. And we understand that all of those environmental factors are also at the root of many of our most significant health disparities. So we know that there are huge steps we can take to improve health that really have nothing to do with treating an illness or an injury, nothing to do with the new medicine that people take. It could be bringing a supermarket to a low-income neighborhood so that families have access to fresh fruits and vegetables. It could be redesigning that neighborhood to make it more walkable so that there's less car pollution, which can often make asthma far worse. Could be prohibiting smoking in public places so that people aren't surrounded by secondhand smoke. Those can be some of the most effective health strategies that we have for improving the prosperity of our country. So over the last 2 years, this administration and our department have taken some unprecedented steps to support those kinds of community efforts across the country. We're doing it through programs called Communities Putting Prevention to Work, which is a key part of Recovery Act investments, funding some of the most promising local strategies across the country for promoting wellness and reducing chronic disease. Over the last couple of years, I've had the opportunity to travel across the country and visited about a dozen of these community prevention sites, from a housing project in Chicago where the residents came together to insist that there be smoke-free choices for folks to live in so that their kids could grow up breathing clean air, to an urban farm setting in Boston where not only students are growing fresh fruits and vegetables in a huge community garden, but they're selling it in farmers market, and they also do bring a garden to a house strategy where door to door they volunteer to neighbors to actually help set up their own gardens. Now, our hope is that these communities can become models for the rest of the country. So if you're a mayor or school principal or a neighborhood activist and want to understand how best to improve health in your school or your community or your city, we'll be able to point to the best practices that are around the country and give you very specific examples of how it changes people's behaviors. And our investment in prevention didn't stop with the Recovery Act. One of the key parts of the new health reform legislation, the Affordable Care Act, is a $15 billion prevention and public health fund that will invest in similar programs across the country, and that prevention fund grows over time. The new law also contains new community transformation grant programs that build on the economic empowerment zone models, but they're aimed at health. Using public-private partnerships, communities will be able to pursue comprehensive strategies to improve health, whether it's promoting better nutrition for kids in schools or creating safer neighborhoods where people can walk and play outside. And like empowerment zones, the grants recognize that the people who often know best how to improve community health are the people who live in those communities. So it actually gets the resources to the folks who have the most at stake, the most investment, and frankly, the most expertise. Now, Congress hasn't yet authorized funds for the grants, but we hope they'll follow through on one of the best investments we can make in our country's health. So with these programs, we're building a healthier America one community at a time. And it isn't easy, but as our Assistant Secretary for Health, Dr. Howard Koh, sometimes says, an ounce of prevention can take a ton of work. But we know it can be done, because communities across the country are already doing it. Now, our department also continues to support research into the connections between environment and health, especially at our National Institute of Environmental Health Sciences and the Centers for Disease Control and Prevention, two very important research entities. We're putting a special emphasis on collaborating with minority communities whose health often suffers the most from environmental factors, recognizing that conducting research in partnership with community residents can build on local knowledge and local skills. And I want to just give you one example. We're working closely with the Navajo Nation in New Mexico to study the possible health consequences of uranium exposure. And to further support that work, we recently awarded a $3 million grant that will allow scientists to study the link between uranium exposure and reproduction. Building those close relationships is allowing us to gain new insights into how the environment affects some of our most vulnerable communities. In our department, we understand the important connection between our environment and our country's health. That's why, for the first time ever this year, we made the social determinants of health a key focus of our Healthy People 2020 initiative. Healthy People 2020 provides a roadmap for how to improve the health of our nation over the next decade. And this year, the report establishes a new core goal of, and I quote, creating social and physical environments that promote good health for all. And that will put the environment at the center of the nation's health agenda. We also know that the Department of Health and Human Services and even the broader public health sector can't do this work alone. If we want to serve healthier school lunches, which is where our kids get so much of their nutrition, we need to work with the Departments of Agriculture and Education, who have key influence over school lunches. If we want to design neighborhoods where it's easier to walk or bike, we need to work with the Department of Transportation. If we want to work to create safer homes, we need to work with the Department of Housing and Urban Development. And that's why each of these agencies, in addition to several others, have seats on the new Prevention Council created by the Affordable Care Act, along with me and our chair, Surgeon General Regina Benjamin. That Prevention Council, which is designed as part of the Affordable Care Act, is working together to develop a new prevention strategy that will be released early next year. And we'll be working together to carry it out as we move forward. But if we need all these other partners at the table when we talk about improving health, we also need to have the health community at the table when we talk about urban planning or food policy or responding to an environmental disaster. We saw that earlier this year in our response to the Gulf oil spill. Whether it was food safety experts determining whether the seafood from the Gulf was safe to continue to eat, health workers providing care for the environmental workers who participated in the cleanup efforts, or mental health counselors providing care in communities devastated by the spill, health professionals were on the front line playing a critical role. And that's why our department is guided by the philosophy of health in all policies. Health in all policies means that at any time we make a decision, we should be asking what are the health consequences. And I want to point out that by building healthy communities, we're also building resilient communities. The same network of local health providers that can help you manage your diabetes should be and can be at the front line of the defense in a public health emergency. The stronger the baseline health of any individual community is, the less vulnerable they are to